Heart is a muscular cone-shaped organ that circulates blood inside of our body, and it's located inside of the chest in the area between two lungs that we call mediastinum. Mediastinum is a space between two lungs and divided to the superior about the base of the heart and inferior. Inferior divided three parts: anterior, front of the heart, middle, or that correspond exactly heart, and posterior mediastinum, that beyond the heart. In posterior mediastinum, we have structure esophagus, aorta, thoracic descending, trachea, and some vessel and nerves. Most of the heart has been surrounded by the lungs, but a specific area of the left lung didn't grow very well during fetus life. The heart pushed that part and create an empty area. We called it cardiac notch. This specific area, it creates for us an acoustic window. Acoustic window means the sound can pass through to that area because air and bone is enemy of the sound and cannot propagate through that area. So this is almost somewhere between 3rd intercostal to 5 intercostal at the left side of the sternum. But sometimes we can access create in the right side parasternal, especially upper part at this area, 2nd and 3rd intercostal right side of the, we call it right parasternal window. That is most in the pediatric. It will be easy to get that window, but in adult, if we'll do a little maneuver, maybe we can get some images later in other clips I explain. I have to mention here, most of my demo on the cross section of the heart belong to this software that created by the Toronto University, and they did great job. And it's free, it's public, everybody can access to that website and practice with that software. I strongly recommend everybody, student, resident, everybody go to that website. It has both transthoracic and transesophageal, so you can cut, move around, different angle, different view, cross section, orientation of the probe, sector, everything is wonderful. And don't forget, if you have enough, it's not bad idea, donate to them, because they have that you can donate whatever you can. Since I am going to use a lot of sector sound in this presentation, I thought it's better I explain a little about the sector. As you know, we have different type of the ultrasound probe or transducer. We have many different Kelvinier, linear, vector, PEDAF, and so on. The pattern of the sound beam has been produced and sent by the sound ultrasound probe. We call it array. Generally speaking, we have three types of the array. Linear, that sound pulse are parallel to each other, and shape, the image shape that show on monitor will be rectangle. Kelvinier will be trapezoid, they diverge, and vector that we use on the transducer for the echo, we call phase array or vector probe, is a pie shape. We called it sector, and on image you can see the image is almost a pie shape, or we call it sector. Just remember, when I talk about the sector plane, means the whole sound pattern that will be sent by the probe. Now let's continue anatomy of the heart. As you can see, the heart is not completely at midline. 1/3 of the heart is on the right side of the midline and 2/3 on the left side of the heart. And as I say, a heart is a cone shape, has one tip we call the apex and one base. The line or plate that passed through to the apex to the baseline we call it long axis, and any plane that is perpendicular to the long axis we call it short axis. It can be different level at the base, at the middle, or at the apex, so that is short axis of them. The orientation of the heart dependent the content of the abdomen, because whatever is inside of the abdomen, push, diaphragm and heart can change the orientation of the heart, and the structure of the chest wall, especially vertebra. Generally speaking, the heart orientation, just for memorizing easy, is not in each patient will be different depending on all those parameters and factors that I said, is 30 to 35 degrees in the plane, in the frontal plane, in horizontal, frontal, and in sagittal view. It looks like cutting the body heart this way, and you are watching from the side. Sagittal view generally is all of them almost between 30 to 30 degrees. But as I say, depending on those parameters, the orientation of the long axis of the heart will change. In the average or general people, this long axis orientation direction is something between 10 and 4 o'clock, between 10 to 10:30 to 4. That means our sector sound that I explained is orientation toward the right side of the shoulder, right shoulder, and the hip. That is in average people. But if in those people with they are tall and skinny, it become more vertical. Instead of the 35, it become a little more 45. Become this way. In the opposite way, those has a big bell and short height. It's become more flat. Here, for example, this patient is almost transverse, 0. So in each cases, the orientation of the heart will be changed. Don't forget, when you are scanning the patient, your sector orientation of your probe will be changed. Don't expect everybody has the same orientation marker toward the right shoulder. No, you have to see the patient, and many times you have to change your orientation of the probe and even location. For example, imagine in this patient, content of the abdomen for any reason, it push up, and so for getting apex, your apex move a little higher and go more lateral. Some patient you go a little higher, more lateral for getting plaques or apical view. Here on the patient you can see almost your probe on this patient will be at pointing between 9 to 10 instead of the 10 to 11 is 9, or sometimes even 9 to 10. So based on those images and landmark, you can manage your probe orientation. Up to the next time, have a wonderful time.